50% of Americans are either pre-diabetic or diabetic. Infants who are type 1 diabetic, they usually develop type 1 diabetes. 75% of the population is either overweight or obese. Just look at those two combinations and you can kind of see it's a recipe for disaster.
Did you know that avoiding certain foods can help you manage or even reverse these conditions?
Today we're going to talk about the foods you need to avoid if you're either pre-diabetic.
Meet Dr. Bobby Price, a certified plant-based nutritionist, exercise physiologist, and doctor of pharmacy. With extensive clinical experience in hospital settings, one-on-one patient contact in community pharmacy, and healthcare regulatory experience with the Food and Drug Administration (FDA), Dr. Price brings a wealth of knowledge to his practice. With years of experience and a deep understanding of holistic health, he has dedicated his career to helping people achieve optimal well-being through natural methods. In today's video, we will uncover the 5 foods Dr. Bobby insists you must avoid entirely if you are diabetic or pre-diabetic. Let's dive into his expert advice on which foods to eliminate for better blood sugar control and overall well-being.
Diabetes is the leading cause of kidney failure, blindness, also the leading cause of amputation, also one of the leading causes of heart disease and stroke.
According to Dr. Bobby Price, managing your diet is crucial to preventing these issues. For individuals with diabetes, the food you choose directly impacts your blood sugar level. Most of the sugar consumed today is man-made and added sugar, not the natural sugars our bodies are designed to process.
Man-made sugar, synthetic sugar, that is really the issue because that sugar in our blood vessels is like shards of glass. As a matter of fact, elevated blood sugar will actually cause damage in the lining of the blood vessels. Okay? Now here's what's important. The blood vessels are not just the highways by which blood takes nutrients to the organ systems. The blood vessels are also in those organs as well too. So they not only cause issues with the blood vessels, they're also causing issues with the actual organs too. Diabetes is one of the #1 causes of kidney failure.
High blood sugar also makes the blood thick and viscous, complicating circulation, especially in the lower limbs, and increasing the risk of nerve damage and amputations. By choosing the right foods and avoiding added sugar, you can better manage your blood sugar levels and prevent these severe complications. Now that we understand the critical impacts of diet on diabetes, let's delve into Dr. Bobby Price's expert advice on the 5 foods you should avoid entirely to maintain better blood sugar control and overall health.
Okay, #1, refined carbohydrates. Okay, you gotta get rid of the refined carbohydrates. As a matter of fact, they are not a food. We are not supposed to be eating any of them. It's not that we're supposed to eat them sparingly. We're supposed to completely eliminate them from our food supply. What are refined carbohydrates? That's white bread, that's white flour, that's breakfast cereals, that's pizza dough, that's white rice, that's pasta. Okay, and notice I said refined. Okay, #2, starches. Okay, starches, again, starch is rice. I mean, even, the rice is a problem as well too, but also corn, potatoes, yuca, cassava for those in the Caribbean and my African brothers and sisters. These are things that you need to remove as well too because they turn into sugar in the body. Potato turns in, especially the white potato, turns straight into sugar. Starch is acidic as well too. And we all know that sugar is acid. It makes the body more acidic as well too, which makes the body more inflamed. #3, high glycemic index foods. Do not drink liquid sugar. That is the worst way to consume sugar because the natural way to consume sugar is through fruit. Fruit have fiber. Okay, so fiber attaches to sugar. Okay, so when you're consuming the fruit and it breaks down, the sugar is still attached to the fiber. The fiber has to be slowly broken down in the stomach. When it's being broken down, that sugar is being slowly released when it's attached to fiber. And then #4, dairy. You want to stay away from dairy and why? And guess where we get a lot of our saturated fat? Dairy products. As a matter of fact, if you were to look at milk, and milk is cheese, but milk is cheese is the water removed from milk. So when you see cheese, like back in the days, you see these blocks of cheese that people would get. That is simply milk with the water removed from it, dehydrated milk, okay? So that leftover portion is the fat. That's all cheese is. It is the fat left over from the milk. So it's so important that you understand that when you're consuming dairy, you're putting fat in the body. Fat deposits not only in your muscles, but also in your liver. Now your liver is fatty. Okay, diabetes is one of the #1 causes of a fatty liver, okay? Which is hugely important. And then number 5, added sugar.
Now that we've explored the foods Dr. Bobby Price advises us to avoid, let's hear an inspiring story that underscores the power of dietary changes in managing diabetes. One such story comes from Neil Barsky, who started his journey in reversing type 2 diabetes through diet changes. During the COVID-19 lockdown, Neil received alarming news from his doctor. His blood sugar levels were dangerously high, indicating diabetes. This diagnosis was a wake-up call for Neil, who had previously managed to stay healthy without major medical issues. Neil began to research and educate himself about type 2 diabetes, learning about the harmful effects of high blood sugar and the critical role of diet in managing the condition. He discovered that the excessive consumption of man-made sugars and carbohydrates was a significant factor in his high blood sugar levels. Motivated by the potential complications of diabetes, such as blindness, kidney failure, and heart disease, Neil decided to make drastic changes to his diet. He eliminated breads, pastas, sweets, and starches from his meals, focusing instead on natural whole foods. Despite the initial difficulty and the temptation of his favorite foods like pizza and bagels, Neil persevered. His efforts paid off remarkably. Not only did his blood sugar levels plummet, but he also felt healthier and more energetic. Neil's story is a powerful testament to the impact of diet on diabetes management. By cutting out harmful sugars and carbohydrates, he was able to reverse his condition and avoid the need for painful and expensive medications. His journey underscores the importance of dietary choices in controlling blood sugar levels and highlights that, with dedication and the right information, managing diabetes through diet is achievable. Managing diabetes through diet is both crucial and achievable. As Dr. Bobby Price has highlighted, avoiding certain foods can make a significant difference. These foods can cause spikes in blood sugar levels, leading to serious complications like heart disease, nerve damage, and kidney failure. Diet plays a pivotal role in controlling diabetes. By eliminating harmful sugars and processed foods, you can stabilize your blood sugar levels, improve your overall health, and potentially reverse your condition. Neil Barsky's inspiring story shows that with the right dietary changes, significant health improvements are possible without relying solely on medication. So, take control of your health by making informed food choices. Focus on natural whole foods and be mindful of the impact your diet has on your body. By doing so, you can manage diabetes more effectively and enjoy a healthier, more vibrant life. Remember, every small change counts towards a healthier future. Take the first step towards better health today by making smarter food choices for your diabetes management. If you found these tips helpful, don't forget to like, comment, and subscribe for more health and wellness insights. Don't miss out on the next video as we continue to share the path to personal health. Life's better with a healthy buzz.